Don't go to your doctor. First thing you need to do is take a big dose of vitamin P. That stands for patience. So you've got a sinus infection. I'm really sorry about that. In this video, I'm going to go over things that might help relieve your symptoms a little bit, things that probably won't help, and things that definitely won't help. I'm Dr. Ken Berry, a family physician with over 20 years of helping people with sinus infections. Let's talk about the science behind this plus the common sense. Now, the first thing I want you to know, and the thing that's going to make it kind of makes sense, what I'm about to tell you, is that 95 to 97% of sinus infections are caused by viruses. Only about 3 to 5% are caused by bacteria. Less than 1% are caused by a fungus. And typically, if you've got a fungal sinus infection, then you have a compromised immune system, and you know you should go to the doctor if you start to have any kind of infection. But this video is for just people with no autoimmune, immune problems, who are relatively well, healthy, out in society, community, and now you've got a sinus infection. So 95 to 97% of sinus infections are viral. That's very important to understand. The average sinus infection is going to last anywhere from 5 to 10 days. So many people, as soon as they start to feel a sinus infection coming on, they're going to either go see their doctor or schedule a Zoom call with their doctor, a virtual doctor visit. 95 to 97% of sinus infections are viral. Now, most doctors, they think that you expect to get a prescription at the end of the visit. And indeed, many people do expect to get a prescription. Would it surprise you to discover that 95 to 97% of the time, an antibiotic prescription is not going to help your sinus infection whatsoever? It's not going to help it get better quicker. It's not going to help it go away sooner. And also, if you take the antibiotic, you're going to be exposed to all the potential side effects, potential bad outcomes from taking an antibiotic, whether you need it or not. In this case, 95 to 97% chance you don't need it, but you're going to be susceptible to all the side effects. And so any doctor who sees you within 1, 2, 3, 4, 5 days of you developing a sinus infection and they prescribe you an antibiotic, that's inappropriate. Especially if a doctor sees you over a Zoom virtual visit and prescribes you an antibiotic within the first 5 days of you developing a sinus infection. That's inappropriate. That's not doing you any favors. Although you feel like you may have got that bottle of prescription pills and that's magic and that's going to fix you, it ain't. 95 to 97% of the time. The reason that many doctors think that you expect a prescription for an antibiotic is because they've been trained to think that by hundreds of patients. I've seen many patients over the decades of my practice who demanded a Z-Pak or demanded Cipro or Levaquin. And I had to take an extra minute, which many doctors don't have, and educate them. This is not going to help you at all. This is viral. This is going to go away on its own. If you take the Z-Pak or the Cipro, you're just exposing yourself to potential side effects and complications. You're going to decimate not only your gut microbiome, but your skin microbiome, your mouth microbiome, and all your other microbiomes, all of which are important, for no damn reason. So I want you to go, if you do go to the doctor, please preface your office visit with, look, if this is viral and an antibiotic's not going to help me, just tell me that. I'm not here expecting a prescription if it's not really going to help. The only thing that your doctor could possibly prescribe for you or give to you that might improve the symptoms of your sinus infection is either a sinus cocktail injection, which is usually some blend of short and longer acting steroids, or a Dex-Pak, Medrol dose pack, prednisone pack medication. These will not make your sinus infection go away quicker. They will only decrease the severity of the symptoms, also again exposing you to the potential side effects and complications that come from taking steroids. There are a few things that you can do at home that are going to probably decrease the severity of your symptoms, and we'll talk about that in just a minute. Next, I want to talk about all the over-the-counter things, because many people don't want to go to the doctor, so they go to the pharmacy and they look up and down. There's one or two aisles that are about nothing except sinus infection symptoms. And so if you're looking at the antihistamines, the decongestants, the nasal sprays, basically all the decongestants and antihistamines. They might help your symptoms a little bit, but for the majority of people, you wind up with antihistamine side effects or decongestant side effects, definitely, that are worse than your actual sinus infection symptoms. What can you get at the pharmacy that might help? Saline nasal spray. That might decrease the severity a little bit. A neti pot, if you're amenable to that. I don't like the idea of pouring water into my nasal passages. Some people like it and swear by it. And then taking an anti-inflammatory like Aleve, Motrin, naproxen for a few days just to knock the edge off the pain and the pressure. That might give you some symptom relief, but in no way is anything in the sinus aisle at the pharmacy going to make your sinus infection go away quicker or make it get better quicker. That's just not going to happen. That is impossible. Sinus infections 95 to 97% of the time are viral, and that means they have to run their course. What about zinc? What about vitamin C? Well, if you're deficient in zinc or you're deficient in vitamin C, then taking a supplement might help your immune system fight off the virus quicker. If you're not deficient, which most people are not, then they're not going to help you at all. You're just going to spend $5 or $10 on something that make you feel like you're doing something, but it's really not going to make it go away any quicker at all. Now let's talk about all the YouTube videos, some of which have millions of views. Drink 1 cup of this and your sinus infection goes away. Touch your forehead here, pinch your earlobe here, touch your thumb, touch the bottom of your foot. There is literally not a shred of evidence that any of these things are going to cure your sinus infection or make it go away quicker. Now, they're excellent busy work, and so if you'd like some busy work while you wait for the 5 to 10 days for your viral sinus infection to go away, then you can do these things. Now, I don't think any of them are going to hurt unless they're very high in sugar. Then they might spike your blood sugar, which could actually make your immune system function worse. But otherwise, you can try all these little crafty, nifty tricks that you saw in an internet video from a chiropractor or a naturopath, but they're not going to help at all. So what can you do at home for your sinus infection? Well, first of all, that stands for patience, because you're gonna have it for 5 to 10 days. Nothing you can do about that, okay? Just know that. Realize that 95 to 97% of the time it's not bacterial. You're gonna get better if you just give it enough time. Also, getting plenty of rest. Even though you may not feel like it, you need to rest. That's gonna help your immune system fight as well as it can. Many people find that viral infections will go away a little quicker if they fast while they're in the midst of a viral infection. So if you're not really hungry, you don't feel like eating, listen to your body. Don't eat. Just sip on some bone broth or sip on some kind of warm liquid with some electrolytes in it, sugar-free, hopefully, and give your body time to do what it needs to do. The anti-inflammatory like ibuprofen or naproxen is going to knock the edge off your symptoms, especially if you've got a little fever and you need to produce. You've got to go to work. You've got to work. If you're working from home, then you can take that for a few days only, in which case the benefits probably outweigh the potential complications. Saline nasal spray might help the symptoms some. Neti pot might help the symptoms some. Elevating the head of your bed while you're asleep may help you sleep, may help you get more restful sleep so you can breathe a little better. But the vast majority of things you see on the internet, there's no research whatsoever. There's no science supporting that drinking a cup of this or touching your forehead here is going to help anything at all. 99% of the things in the sinus aisle at the pharmacy are completely and utterly worthless and often leave you with more symptoms than if you just left the sinus infection alone. 95 to 97% of the time, you don't need the antibiotic from your doctor, so don't waste the copay, don't waste the time for the visit, and definitely don't take the chance of the side effects or complications from taking an antibiotic that you don't even need anyway. Hey y'all, Dr. Barry here. I just had to jump in and tell you about my Proper Human Diet Guidebook. The very fact that you're watching this video tells me you're interested in the lifestyle that I've come to call a proper human diet. Maybe you're new to these ideas and you just need a rough guidebook to guide you through the principles of a proper human diet. Well, you're in the right spot and I've got your back. I've put together the ultimate guide that will lead you right back to your optimal levels of health. It's packed with my 11 principles of a proper human diet, a list of foods that you should absolutely include in your proper human diet, and a list of things that you need to avoid. We talk about everything from main courses down to condiments and spices. Following these tips, our community has helped countless people reclaim their best health. Take Nicole, for example. She's been virtually pain-free for over 22 months, all autoimmune conditions in remission. Oh, and she's also lost 134 pounds. Her last triglyceride level, a jaw-dropping 45 on her last blood labs. Then there's Rick, off of all of his medications now and suffering from none of the previous chronic complaints that he used to have. Joint pain, sleep apnea, fatigue, 6 stents, multiple hospitalizations, and a hefty dose of statins, none of which really helped him. Now here's the best part. The Proper Human Diet Guidebook is absolutely free for you and always will be. I just want you to live your best life. Okay, that's my quick interruption. Sorry, let's get back to the video. Now, what if you have a bacterial infection? Because 3 to 5% of the time it is bacterial. How will you know? Well, this is how you'll know. If it gets progressively worse starting about the 5th or 7th day, because what you would expect is about the 7th day you're going to wake up and say, it's no worse, maybe a little better, but I still feel like crap. That's a viral sinus infection. But if you wake up on the 7th day and you're like, oh my God, it's way worse, okay, and it proceeds to get worse and worse, your fever starts to go up more and more after the 7th day, then it may be time to schedule an appointment with your doctor, because the odds of this being a bacterial infection start to go up. Now, when you go see your doctor, especially if you go in the first 5 days of your sinus infection, how does your doctor know if it's bacterial or not? Well, the average doctor is going to just take a history, basically ask you some questions, and they might poke around on you a little bit, look in your mouth, look at your throat. Literally none of that's going to tell your doctor if this is bacterial versus viral. Okay? There are some tests that your doctor can do, but it involves sticking something far up your nose, either an endoscope or a swab, and actually taking a culture from the sinus os, the opening where the sinus drains into your nasal cavities, or running an endoscope actually into your sinuses and taking a culture, or doing a CAT scan or an MRI of your sinuses. Even a x-ray of your sinuses, unless you have an advanced case of sinusitis, it's not going to give the doctor any relevant information whatsoever. So without imaging and without a culture, your doctor is literally flipping a coin as to whether this is viral or bacterial, because in the first 5 to 7 days, they both act exactly the same. So to sum up, you got a sinus infection. Get plenty of rest, drink fluids, add some electrolytes, sip on some bone broth or your grandmother's chicken soup. That's fine. Just watch out for the noodles, because they definitely won't help anything. Don't go to your doctor unless you're progressively getting worse after the 7th day of your sinus infection. Don't waste your time. Don't take medications you don't need. Avoid the sinus aisle at the pharmacy. There's nothing there that's going to help you. It's just going to cost you money. Use some nasal saline spray. Use a neti pot if that's your thing. Take some anti-inflammatory like ibuprofen to leave, and that'll knock the edge off the symptoms. But there is literally nothing under God's sun that is going to make your sinus infection go away quicker if it's viral, and it's viral 95 to 97% of the time. Hope this video helps. Hang in there. You're going to get better. I promise it's going to be fine. See you next time.